from. Good morning, doctor. First off, how does one get clogged arteries?
Well, you get it from a whole host of different issues that can provide to this problem. You can get it from high blood pressure that's not very well controlled. That causes plaques to build up in the arteries. You can get it from high cholesterol that also leads to those plaques forming on the inside of the arteries. Diabetes, where you're not really controlling your blood sugars, that can lead to clogged arteries. And of course, genetics. You know, we can't fight our genetics. So those four factors are really important. And less commonly, what can also happen is you can actually have blood clots form within the arteries. But usually it's a combination of the two. If you have a very clean, fresh artery without any plaque, secondary to the high blood pressure, the diabetes, or the high cholesterol, you usually don't have clots, but sometimes you can have clots.
What can we do about it? You don't really know right now if you have it unless you've been diagnosed. So how do you try to slow it down, stop it? Is there a way to get checked?
Well, the best way to slow it down is by improving lifestyle. Our genetics, we can't really do much about, but the environment, we certainly can. So regular exercise is a great way to keep healthy and minimize the risk of developing plaques, or at least minimizing the risk given your particular situation. Making sure that you get checked out regularly, and if you have high blood pressure, taking your medications appropriately, watching your blood sugars, keeping an appropriate body weight. That helps, because if you're heavy, as we've talked about multiple times, that can increase your risk of having high blood pressure and high blood sugar with diabetes. Of course, one other issue is people with kidney trouble. And the kidney trouble is a result of the issues we mentioned already, but once you have bad kidneys, that really increases your risk of having clogged arteries as well.
And this isn't a new problem. Quickly, like I had said while we were speaking before the segment, I read that mummies had been discovered to have clogged arteries.
Certainly, it's been all along. We've always had a certain segment of our population that eats food that may be a little bit too rich and perhaps isn't as active as they should be, and genetics. Our genes have been around as long as we have.
That's exactly true. They have better been. Well, thank you very much, Dr. Vijay, for showing up. And anyone out there ever has a medical question they need answered by the doctor, email us here at the station or send your question